So what happens? A resident develops an infection, bacteria gets into the blood vessels begin leaking, leading to organ dysfunction, and if not treated, worsening organ dysfunction and ultimately death. So sepsis often originates with an infection in the lungs, urinary tract, abdomen, or a surgical site. Respiratory tract infections are the most common site of infection causing sepsis and are associated with the highest mortality. Respiratory tract infections and urinary tract infections are the top two types of infection causing sepsis in long-term care. But I want you to keep in mind that the infection can be as seemingly insignificant as an infected splinter. I read an article this past summer where a woman developed sepsis from an infected splinter she got from gardening. And likewise, my nephew developed sepsis from an infected splinter he got from falling into the mulch on a playground. These are just two examples of why the CDC has a campaign to educate the public about the signs and symptoms of sepsis, and if sepsis is suspected, seek immediate medical attention and ask, could it be sepsis? Sepsis worsens health status and increases disability among its survivors. Long-term effects can include sepsis-induced inflammation, immunosuppression, functional disability, and/or cognitive impairment. The Surviving Sepsis Campaign, or SSC, is a joint effort between the Society of Critical Care Medicine and the European Society of Intensive Care Medicine, and their goal is to reduce mortality from sepsis and septic shock globally. The 2012 International Guidelines for Management of Severe Sepsis and Septic Shock state early recognition of sepsis and implementation of evidence-based therapies improves outcomes and decreases mortality, and routine screening of potentially infected, seriously ill patients for sepsis to improve the early identification of sepsis and allow implementation of sepsis therapy is listed as a grade 1C recommendation. So in a nutshell, the goal is to identify sepsis early, to begin treatment early, to prevent progression to worsening organ dysfunction and death. Developed and validated sepsis screening tools generally evaluate three areas. They evaluate the known or suspected infection. They evaluate systemic manifestations such as hyperthermia or hypothermia, tachycardia, tachypnea, acute mental status change, leukocytosis or leukopenia, and hyperglycemia. And they evaluate new or worsened organ dysfunction displayed by hypotension, increasing oxygen requirements, elevated lactate, creatinine, and/or bilirubin levels, thrombocytopenia, and coagulopathy. The signs of both infection and organ dysfunction may be subtle and difficult to recognize in older adults with comorbidities. Fever may be absent. There's a lower incidence of tachycardia and hypoxemia. Confusion, delirium, weakness, falls, anorexia, and incontinence can all be nonspecific in older adults. So we need long-term specific sepsis screening tools. Ideally, a validated sepsis screening tool should be adopted and used routinely on all residents. A certified nursing assistant or a CNA could perform the initial screening at the bedside, and positive screening results would be reported to and verified immediately by the licensed nurse. The licensed nurse would then evaluate and document any acute changes and communicate the resident status to the nurse, practitioner, physician assistant, or physician. The clinician would evaluate the resident, review the resident's advance directive, and may direct medical management and/or transfer to a higher level of care within the facility or to the hospital. Interventions to reduce acute care transfers, Interact, provides educational and clinical tools to detect early acute changes in long-term care residents. Stop and Watch is a vertical acronym that lists conditions that identify a potential change in a resident's condition. The Stop and Watch early warning tool can be used by CNAs, therapists, and even dietary and environmental service workers and family members to alert the licensed nurse that a resident has a potential change in condition that needs further clinical evaluation. Situation, background, appearance, and review and notify, the SBAR, is an assessment and communication tool that guides the nurse when a resident has a changing condition. The SBAR communication form and progress note for RNs, LPN, and LVNs evaluate the resident's condition before contacting the clinician or other healthcare professional. There's also an area there to document the primary care clinician's recommendations. And these are the tools I just spoke about. We sent these to you as handouts. On the left is the stop and watch tool, and as you can see, it asks some subjective questions such as, the resident seems different than usual, that can be answered by those who interact with the patient regularly, such as CNAs and environmental service workers. And on the right-hand side is just the first of 4 pages of the SBAR communication form. The Minnesota Hospital Association, the MHA, developed a long-term care specific Seeing Sepsis Toolkit. The MHA's long-term care resources include Seeing Sepsis cards and posters that alert the user to notify the nurse to screen for sepsis if the resident's temperature is higher than 100 degrees Fahrenheit, the heart rate is greater than 100 beats per minute, and or the systolic blood pressure is lower than 100 milligrams of mercury and the resident just doesn't look right. Their Act Fast document for long-term care provides for the same screening alerts plus next steps for medical providers in the event of a positive sepsis screen. Again, all of these tools have been designed to facilitate the early detection of sepsis and allow for implementation of sepsis therapy. The key to survival is to identify sepsis early. Screening in long-term care facilities could promote treatment while awaiting transfer, saving precious time. Long-term care facilities that use electronic health records could consider incorporating their chosen sepsis screening tool into their system to aid in early identification of sepsis. So let's say you have a resident who is screened positive for sepsis. Now what? Well, the first treatment steps include measuring the lactate level and drawing blood cultures. Those are the initial steps in the SSC bundle and could be accomplished in long-term care facilities with laboratory capabilities. Intravenous access and administration of broad-spectrum antibiotics and crystalloids are the next steps in the SSC bundle and could be accomplished prior to transfer. But keep in mind that the blood culture should be drawn prior to administering the antibiotic. So I want to talk for a couple of minutes about simulation training in healthcare. Experiential education allows participants to develop new knowledge and skills in a controlled and supported learning environment and without direct risk to patients. Simulation improves critical thinking, performance skills, and knowledge of subject matter, and increases clinical reasoning in certain areas. A core benefit is the measurable improvement in patient safety. Simulation training for long-term care staff in early recognition of sepsis should include recognizing early symptoms of sepsis, utilizing the standardized screening tool, and promptly communicating those symptoms among the healthcare team, utilizing a communication algorithm. A facilitator should lead the participants through realistic scenarios, and then followed by a simulation debriefing where the group reflects and engages in safe conversations to identify strengths, weaknesses, and opportunities for improvement. Participants gain confidence while discussing what went well and what could be improved. A study by Mihalcevic and Howard incorporated interdisciplinary sepsis simulations in 19 long-term care facilities in Western PA. It included licensed nurses, CNAs, and therapy staff, and they used Interact's Stop and Watch and SBAR tools. Their goal was to communicate effectively and intervene quickly on behalf of residents in sepsis. Study findings show that the participants completed a survey to provide feedback on their experience, and an overwhelming majority found a high level of satisfaction with the experience and looked forward to similar education and training in the future. Simulation helped implement sepsis education. It reinforced interdisciplinary communication in the long-term care setting, and stimulated adoption of these tools in many long-term care organizations. So our conclusions for today: early recognition of sepsis and implementation of evidence-based therapies have the potential to save lives. Despite the prevalence and serious consequences of sepsis, its early diagnosis is challenging for long-term care team members. Therefore, sepsis may be underdiagnosed when it is still potentially reversible. The use of a validated sepsis screening tool by long-term care facilities to identify sepsis early and to standardize communication among long-term care team members may decrease adverse outcomes. In simulation sepsis, using a sepsis screening tool has been shown to improve the user's ability to effectively recognize and communicate changes in a resident's condition that may indicate sepsis. And we sent a copy of the recent Pennsylvania Patient Safety Authority article on this subject to you as a handout. Jim and I are the co-authors, and you may refer to it if you have specific questions about anything that I have presented to you today.